Hello, everyone. Welcome to our presentation on virtual cases, real-life solutions, meeting ARCPA standards with Aquifer. My name is Kathy Earhart. I'm the program director at DeSales University PA program. Joining me this presentation is Darcy Larimore-Arenas, who's faculty at Touro University in California. This is our agenda, what we were going to be covering today, so you can follow along. So welcome to Aquifer. Aquifer is a wonderful platform that allows students to go through virtual patient cases to help build their clinical decision-making skills. These are scenarios that provide students with very deep and realistic patient experiences, scenarios, and the students are able to go through them at their own pace and learn at each step. Aquifer is a nonprofit organization, and they're dedicated to provide the best healthcare education out there through collaborative development and research. They're always working to have more and more innovative approaches and having high impact virtual teaching and learning methods. Aquifer is an interdisciplinary program by educators for educators. All Aquifer content is developed and maintained by this team of educators who work to ensure that the cases and the learning tools that are available are accurate and up to date. And the network is growing. More and more educators join this collaborative team. Aquifer has a significant impact. Over this last year, 1.7 million cases were completed. 96% of all US allopathic schools, medical schools use Aquifer. 100 physician assistant programs currently use Aquifer. And there was 323 academic contributors last year to Aquifer. If you've never heard of Aquifer or you've not used it, there are free courses available. And that's how our program at DeSales started using Aquifer. We started with the free courses. These courses can be accessed by you and your program and your students. There are more than 30 free cases on these interdisciplinary topics. And coming on Friday, October 15th, all teachers and learners will be able to gain access to the new Foundations of Telemedicine course, which provides a basic knowledge to prepare students for telemed visits in less than an hour. For the subscription-based courses, Aquifer offers a full library of these subscription-based courses in a range of disciplines. Each course has 20 to 40 cases. And you can learn more about these courses on aquifer.org. So I want to talk to you a little bit about our program and how our program started using Aquifer and how we built a hybrid women's health rotation using Aquifer. So initially during the pandemic, we started using the free courses in Aquifer to provide a virtual family practice rotation. And I will share a little bit about the data at the end of my presentation and how we're going to use that acquisition of data to evaluate our new women's health curriculum. So we wanted to continue to provide a very robust women's health experience to our students and wanted to use our preceptors to their full potential. We evaluated our curriculum and our Typhon evaluation by the students to see what topics they were seeing on clinical rotations and what important topics they weren't. And we use this to make sure that we are meeting our standards. What we do for our virtual women's health curriculum is our students in that 5-week rotation have about 2 weeks of in-person skippies, direct patient care with women's health providers, physicians, physician assistants, and nurse practitioners. And they have about 2 weeks where we use Aquifer cases. We have 23 Aquifer cases that was selected based on critical material in women's health that we need our students to see. And we also created 8 simulated cases where the students go into our sim center and have both high fidelity and low fidelity mannequins and use standardized patients for these cases. When the students are on the 2 weeks virtual experience with Aquifer and the simulated cases, we bring in women's health providers from the community. And we're also blessed to have 2 women's health providers on our faculty. And these providers work with the students that are on the virtual component to go through these cases, answer questions, and provide interaction with the students. So the students, it's basically like a grand rounds experience for these students. So what's very, very important is to evaluate our outcomes. So this is a new program that we started, this women's health curriculum. We just started with a pilot program. Our pilot program, we brought in 2 recent graduates from our program that work in women's health, one year graduate and a graduate that was out for 2 years. And we brought them back and we put them through the curriculum, the virtual component, and they evaluated it. And we also had a student do the virtual component who graduated in 2021 and evaluated that data. What's important to be able to assess equivalency of rotations, specifically ARCPA standard B 1.04b, is you need to evaluate all aspects: the end of rotation assignments, the preceptor evaluations, the Typhon logging, what students are seeing, and their overall course grade. And we've done this in depth for our virtual family practice rotation, which we started initially, and we're starting to do this with our women's health curriculum as well. So this is some of the data that we have. We looked at the frequency statistics. Now, again, this is the family practice rotation, virtual family practice rotation. We looked at the average raw exam scores, the average raw evaluation scores of the rotation, the preceptor evaluations, and we found that the total scores were higher for the group that did the virtual family practice rotation experience as compared to the students who had a full 5 weeks in-person family practice rotation. So my takeaway and tips using Aquifer is creating a virtual rotation or a partial virtual rotation really helps maximize preceptor availability by bringing preceptors in and having them work with students in both simulated cases as well as with Aquifer cases, allows the students more one-on-one interactions with preceptors. And we also combine that with Skippy rotations when they're actually in the clinics as well. We determine what Aquifer cases to use in our curriculum based on evaluating student logging over the last 5 years to determine what students are seeing and what they're not seeing and what is critical to their education knowledge. And we evaluate student performance data in all aspects. This allows us to make sure that the student learning experience meets our learning outcomes and our ARC requirements. And we will continue to triangulate this data with both PACRAT and PANTS results for further evaluation. Now we're going to have Darcy talk about the use of Aquifer in her program.
So thank you for the introduction, Kathy. My name is Darcy Larimore-Arenas. I'm an assistant professor at Touro University California's dual physician assistant and master of public health program. Let's go ahead and talk about how our program utilizes Aquifer. I have a lot of explaining to do when it comes to how our program uses this platform, because initially we began utilizing Aquifer in 2018 with the free cases. We paid for a subscription starting in 2019. And initially, the cases were applied to clinical year students only to help fill in knowledge gaps for students who maybe had shortened rotations and couldn't enjoy the full 6-week experience, or if we found that there was remediation necessary for students on EORs. So for about a year and a half, the clinical year was the only place that we utilized Aquifer, and quickly realized how valuable the cases were. And it primed us to be in a good place to implement more cases from Aquifer during didactic curriculum as well, especially when COVID hit. So what we're trying to do is really look for how we can assist with students developing clinical reasoning. And so now we spread all of the Aquifer cases across both didactic and clinical in order to provide more opportunities for clinical reasoning in a safe environment. And the way that we figure out what students need to be working on comes from the ARC-PA standards, the NCCPA blueprint, and we've been matching Aquifer cases to those needs. So how do we do this? In our program, we have a dual Master of Science and Physician Assistant Studies, Master of Public Health. The total program is 33 months long. And initially, as I mentioned, we began with Aquifer cases in clinical year, but have recognized how we can expand these cases. So now Aquifer cases are being utilized in every didactic course and continually through the clinical year, as well as our summative course when students come back from rotations. This slide gives you an example of a tracking program that our medical director came up with. Because we utilize so many different Aquifer cases across the spectrum of the library that's available, we really had to find a way to keep track and make sure we weren't being redundant with our case use across didactic and clinical year, as well as applying all cases that we feel we could give benefit to our students with, so that we're not omitting any valuable work either. So the clinical year team worked very hard during COVID to actually utilize dozens of Aquifer cases and create unique virtual rotations for our students, which allowed them to continue with their clinical rotations on time. And these students are now set to graduate on time. So as you can see, we definitely have to track it in a few different ways. We can track both by cohort, classes, semesters, as well as we track by case usage. So if you find a great case in Aquifer and you're one of our faculty, you want to go to our master list, check and make sure it's not being utilized somewhere else in the didactic or clinical curriculum, and then you can apply it for your course. So a personal example, I teach the clinical applications 4 course, which is a brief intersession, a small semester. It's not a full semester. It's truncated before students go out on rotations. And it's really trying to help students transition from didactic to clinical year. And so one of my cases that I've been using for my clinical applications 4 course is a cognitive bias case, and it's mini case 3A. And what I do to apply this case, and if you ask a different faculty member in our program, they'll give you a different way that they use Aquifer. My preference is to make the case available to students prior to the class meeting, but not ask them to work it on their own until we get together in the class meeting. I then break students up into small groups, and I ask them to work through each section of the case together with their group. For example, we start with HPI, break them up for roughly 10 to 15 minutes. We come back together as a class, and I ask all of the groups to share something new that they learned from that component, a question that they still have, something that they felt very comfortable with. And we go around as a grand rounds in the class, repeat the process for each component in the case. So I break them back up for the different components, the physical exam, the diagnostics. So at the end of the case in total, we're able to come back together and review as a postmortem, and it helps me to identify where my students are lacking in clinical reasoning, or if it's a medical fund of knowledge concern. So it gives me excellent lifetime feedback, and the students are able to recognize both their strengths and their weaknesses by having to work through this case in a safe environment. So they're not out on a floor or a bedside in the ER. What we found from working cases this way, as one of the examples of how we utilize Aquifer, is that students overwhelmingly on their evaluations respond positively. They really enjoy being able to practice the clinical reasoning, work through all of the components of an encounter that they've learned in a supportive team, peer-led environment, but also have the guidance of a faculty member to say, did you consider this particular component, or why did you feel that that was the assessment? And so it's given us a lot of excellent feedback on student evals. In addition to objectively, we can see that students perform better on vignette questions in our testing. So students do respond that they have more confidence going into medical decision making. And again, this is uniquely primed at a time when they're just about to step out on rotations. So basically, if I were to give my takeaways and tips for Aquifer usage, it is never too late to start. I was not one of the first adopters for Aquifer in our faculty, but now I'm one of the most ardent cheerleaders for it. So if you ever feel like it's something you might be interested in, go play around on the platform, check out some of the cases. Again, there are free cases to give you a taste of what you might be able to share with your students. You can ask colleagues, ask not only the colleagues in your own university or program, but across the country. I found new applications for Aquifer by sharing with other PA educators, and it's been incredibly powerful. And I always say, if you're concerned about how to start, there's educator resources, but really just getting into the site and looking around, I guarantee you'll be able to find something that works for your students. So the Aquifer Physician Assistant Task Force is a group of passionate PA educators who feel strongly across the country about how to make Aquifer really work for PA education and our PA students. So it's been an incredible experience. It began in 2020 to bring PAs together and really give a voice to Aquifer. I got involved in the PA task force because the more I had started utilizing Aquifer, the more powerful I felt the platform is. And I was really excited to be able to contribute to what I felt could make Aquifer even stronger and more tailored for the needs of the PA educator and PA student. It's one thing to say, I wish it did this. It's another thing entirely to get involved and say, here, let me help it do this. And so that's why I stepped up for the task force this year. So what we've been working on is mapping to ARC-PA standards and really working on searchability for Aquifer cases, utilizing the best possible way to efficiently search and get what you're looking for out of this vast library of resources, as well as specifically how to tailor it to our needs for ARC-PA and help our students meet those standards. So we're always looking for more feedback. We're working continually on this. We were actually just meeting yesterday to try to forward this work. So we're always excited to hear from other educators what your feedback is, your tips, the different tools that you use and how you use them. So we're always excited to hear from other folks about how Aquifer is applied in your program. Thank you.